I want to thank you for the manner in which you've conducted the hearing. Everybody, you've been exceptionally generous with the time and kept us focused and very civil. So you can be very proud of your performance here, and we're all very proud of you. And I want to thank all of our witnesses as well. Each of you have brought insight, knowledge, professionalism. You've all contributed to helping us grapple with what's, a challenge at the societal level. And obviously we heard a great deal today about the majority's highest priority in Congress, which is, in my view, putting everyone in a one-size-fits-all government-run health plan that will double everybody's taxes, eliminate choice, and put Medicare at risk. It'll take plans away from 173 million Americans and give them something they may or may not want, and something they may or may not be willing to pay for. As we heard from Dr. Blayhouse, Medicare for All would cost a staggering amount, more than $32 trillion over 10 years. It's worth thinking about that. The current federal budget annually is about $4.5 trillion. This would make it immediately $7.7 trillion. The legislation has not proposed any way to pay for that. But Dr. Blayhouse told us that even if you doubled everybody's taxes, doubled the corporate tax rate, still wouldn't cover these costs. And as my friend Mr. Woodall pointed out, we're not paying for all the health care we're getting now. We're putting an awful lot of it on the national credit card. Dr. Baker offered up several ways to pay for this in his testimony, but many of those involve what euphemistically are called input costs, or what everybody in the healthcare industry would call more than a 40% cut in their compensation. I can't imagine that an entire industry would accept that level of reduction. And I would also note that such cuts would put everybody's health care at risk. Indeed, Ms. Turner testified that many hospitals would simply close if they had to take 40% pay cuts, as envisioned in this bill. If such cuts become law, the Medicare for All truly would become nothing more than a program that provided minimal care in exchange for astronomically high taxes and much longer wait times. Most disturbingly to me, I think today's hearing made clear that the Medicare for All would put the current Medicare system at risk. If we force doctors and hospitals to take lower payments, we run the risk of pushing them out of the industry entirely, thus making it impossible for current Medicare beneficiaries who've paid into this program for a lifetime to receive health care. In my home district, rural hospitals rely on higher reimbursement rates from private insurance to offset the lower reimbursement rates from Medicare patients. If these hospitals were to only be reimbursed at Medicare rates, most of them, quite frankly, would close. If nothing else, today's hearing shows that the committees of jurisdiction need to consider this bill as well. And I'm proud that you have both called on that, Mr. Chairman, and announced that at least one of those are going to take it up. I particularly hope my friend Mr. Burgess gets another crack at this in the Energy and Commerce Subcommittee, and certainly our committee, and the Ways and Means Committee, and the Education Committee and Labor Committee as well. All of them, frankly, have significantly more jurisdiction in this area than we have here. And to be uncharacteristically humble for our committee and ourselves, they probably have more expertise than we have here, because they have both the staff and they. I'll let you argue that with Mr. Neal and his counterparts. So you guys can work, and Mr. Pallone, because frankly they do. I mean, they just focus on these things. I guess what? I probably know more on Indian health and some of these things because I focus more on it. We don't have hearings up here. This is an unusual moment for us and a good one. I'm not complaining about that, but I'm glad you're going to have the opportunity for these issues to be discussed in front of committees of jurisdiction. Though I think the Democratic Medicare for All proposal is an extreme one. I'd remind the majority that Republicans are, as Ms. Lesko said, committed to working together to improve the system we currently have and to build on and improve what works and ensure that every American gets the quality of care that they deserve. And while it's always fashionable to want to do a once and for all total comprehensive bill, we went through that with the ACA. And with all due respects to my friends, I heard phrases like keep the doctor, if you like the doctor you have, you can keep him. You like the plan you have, you can keep it. And, finally, your insurance payments are going to decline by $2,500. None of those things happen. So count me as skeptical that a new one-size-fits-all system will achieve the objectives that its advocates have laid out with such hope, such optimism and such hope. And, again, it's worth discussing for sure. I would hope in the meantime, though, we do what everybody here agreed we ought to do, in addition to looking at this, which I have no objection to, that we actually focus on smaller steps that we know can become law, that we know can actually happen. And I look forward to working with my good friends on the other side of the aisle, certainly with you, Mr. Chairman, to make sure that we can do something that matters in the weeks and months ahead and makes a big difference. And so with that, Mr. Chairman, again, thank you for the hearing. Thank you for the manner in which it's been conducted. I yield back my time.
Well, thank you. And let me also